A hospital environment designed to be elder-friendly will reduce and prevent delirium. Some simple changes include large, easy-to-read room numbers and other strategies to help patients find their way around with less confusion. Bathroom mirrors low enough to be seen from a wheelchair encourage self-care and independence. Newspapers, calendars, and clocks help with orientation and engagement in daily life.
Hi, Gord. It's Donna.
I'm your nurse today. Do you remember me?
I've been looking after you all morning.
The most important thing a nurse needs to do when she's calming a delusional patient is to be reassuring and calming.
How are you feeling? Not so good? Take a minute. Wake up.
To provide a restful environment with a minimal of distractions.
It's lunchtime. We're going to have something to eat.
The person might need to be fed because for the time being they've forgotten how to do that.
We're going to sit you up on the side of the bed.
And most of all, don't argue with their delusions. If they think there's a snake on the foot of the bed, all they really need to know is that you're going to keep them safe and take care of them.
One of the things that we often find with our older adults, if they do become delirious, is they'll pull out their tubes. So we do not use Foley catheters. We avoid them. If a patient cannot void, we will do in and out caths. We try to get them up to a commode at the minimum and get them to void. They empty their bladder. We don't have as many urinary tract infections because the bladder is totally empty. There's not that little residual that's left there. Also, that getting up and down really helps to ambulate the patient, get circulation going, get oxygen to the brain, and keep them orientated. It's also a normal function, so we try to create normal functions. With our intravenous, we often will have an infuser plug put in, so if they do remove it, often it's not the site that we have lost, but just simply the tubing. We also try to get them hydrated quite quickly so we can get rid of that IV.
Now, why don't you take a sip of apple juice while I start to open your containers for you?
Okay.